You are looking at a 4D model of the heart constructed using visualization software of a gated cardiac or coronary CT angiogram taken at 625 microns. This 4D heart model allows us to better visualize the structures related to cardiac circulation. Blood returning from the body will return to the right atrium, either using the superior vena cava or the inferior vena cava. From the right atrium, blood will then flow to the right ventricle through the tricuspid or right atrioventricular valve. From the right ventricle, blood will flow out through the pulmonary semilunar valve to the pulmonary trunk, which then splits to the right and left pulmonary arteries. At this point, the blood will then reach the lungs to become reoxygenated or oxygen-rich. Blood returning from the lungs after it has received oxygen will return to the posterior aspect of the heart to the left atrium, using either the right or left pulmonary veins. As you can see, there are 2 pulmonary veins per pulmonary artery. Blood will then flow from the left atrium to the left ventricle through the bicuspid or left atrioventricular valve. From here, blood will flow up and out through the ascending aorta after passing through the aortic semilunar valve. Off the aorta, we can see the right coronary artery passing deep to the right auricle, an appendage from the right atrium. The right coronary artery courses in a shallow depression known as the coronary sulcus located between the right atrium and the right ventricle. The left coronary artery is more on the anterior surface of the heart and passes posterior to the pulmonary trunk deep to the left auricle, and will quickly branch into the left anterior descending artery, which courses antero-inferiorly towards the apex of the heart and supplies the left ventricle. Remember, the left ventricle is thicker than the right ventricle, as it is responsible for pumping blood to the entire body and not to just the lungs. The remainder of the left coronary artery will continue as a circumflex branch, giving off the left marginal artery, which also assists in blood supply to the left ventricle. Blood returning from the heart will utilize the cardiac veins to return to the coronary sinus. One example is the middle cardiac vein seen here, located near the posterior interventricular artery on the posterior aspect of the heart. All of this blood from the heart will return back to the right atrium where it joins the deoxygenated blood from the body. Here we can see views of the heart in 3 different orientations. We can see the left atrium filled with contrast fluid, as well as the left ventricle and the functioning bicuspid valve. We can also see the semilunar valve, as well as the ascending aorta. By slowing down the heart, we can see the papillary muscles, as well as the right ventricle and right atrium, as well as blood flowing through the tricuspid valve. By slowing down the video, we can see both the contractile or systolic phase, as well as the relaxing or diastolic phases of the heart rhythm.